On this Monday night, Canada's new recommendations on the Oxford-AstraZeneca vaccine. Who won't be getting this shot? Plus, BC's strategy to delay the second dose. How long people will have to wait. Inoculation desperation among parents.
It's something to keep you up awake at night.
When vaccines could finally be available to children. No apology and no answers.
We were terrorized for 1 hour by the RCMP.
The firefighters caught in the crossfire of the manhunt for Nova Scotia's mass murderer. And well wishes for Prince Philip.
This is hard.
The Duke's longest hospital stay yet.
Global National with Donna Friesen.
Good evening and thanks for joining us. It is the first day of March 2021, a full year since it really began to dawn on us that COVID-19 was going to change all of our lives. Vaccines keep rolling out and that is offering hope, but no community is immune to dangerous flare-ups. Take Prince Edward Island as an example. After months of keeping cases at bay there, the province entered a snap 72-hour lockdown today because of a sudden sharp rise in cases. Last week, there were 3 active cases on PEI. Now there are 18, with no clear link to travel. Officials are trying to trace where they came from. PEI, like other provinces, has started rolling out vaccines to elderly residents because they are the most at risk. But with a limited supply, it is slow going. As of today, just over 3.6% of Canadians have received at least one vaccine dose. In the U.S., by comparison, about 14% of the population has received at least a single dose. Canada's vaccine supply is expected to get a big boost this week with the first shipment of the AstraZeneca doses. On Friday, Health Canada approved that vaccine for people over the age of 18. Then late today, the committee that advises Health Canada on vaccines seemed to contradict that, recommending the AstraZeneca shot not be given to people over the age of 65. Abigail Bimman has been following the vaccine rollout for us. Abigail, this is going to be confusing for people. What more can you tell us?
Well, Donna, the new guidelines from the National Advisory Committee on Immunization cite limited information about its effectiveness in older people as the reason it's not recommending it be used in people 65 and over. Complicating things, the very same day, Public Health England released data from a real-world study showing the Oxford-AstraZeneca vaccine is, quote, highly effective in reducing infections among people 70 and older. And on Friday, Health Canada also cited real-world evidence showing this vaccine is effective in older people, especially at preventing severe disease and hospitalizations. But like with all NACI recommendations, it will be up to the provinces to decide what happens as seniors across the country start to get their first shots.
I can't wait to get back to my gym.
At 84, Guy Riviere is among those over 80 who got their first shots at one of several Montreal area clinics that opened Monday, itching for a normal life after a long year.
Our sons have been terrific and they've helped us through all of this, and now they say, I can't wait to hug you. So I'll wait for another 14 days and I'll get my hug.
Mass interest in mass vaccinations means some challenges.
We did have a little bit of a hiccup today with one of our computer systems. It created maybe about a 10-minute delay, but we were ready with a old school, shall we say, paper version.
In Ontario, websites and phone lines overloaded as more public health units began to start vaccinations for those 80 or 85 and older. All the appointments in York Region fully booked before noon.
We were hours trying, and then you go, the website freezes. It's a disaster.
While in Toronto, no word on a start date.
As the largest city in the country, we have much more ground to cover.
Ontario is still 2 weeks away from launching its province-wide booking portal with a patchwork of plans across each local health unit.
There's no confusion. Some regions are opening up more quickly because they started earlier. They're more advanced in the priorities.
And in Manitoba, people 95 and over and Indigenous people 75 and over are also eligible for the shot.
You'll come back in 3 weeks and see me again?
While Ottawa is being tight-lipped about delivery dates for the AstraZeneca vaccine, Verity Pharmaceuticals tells Global News the first 500,000 doses will arrive here from India mid-week. But if that vaccine isn't going to be used on people 65 and older, it won't speed up the vaccine rollout for Canada's elderly. Donna?
All right, interesting, Abigail Bimman in Ottawa, thanks. So British Columbia has decided to extend the time between the first and second doses of the Moderna and Pfizer vaccines to 4 months. The aim is to get one dose into more people sooner, giving them at least some protection. It's part of phase 2 of the vaccine rollout in BC, focused on people over the age of 80. Robin Gill explains the plan.
How are you feeling today, Mom?
Good. This is as close to company as Shirley MacDonald gets these days. A daily dose of her dutiful daughter to make sure Mum is safe.
I haven't liked it one bit because you're separated from your family and friends.
There's finally some relief for the 90-year-old. She's set to get the COVID-19 shot in the next 2 weeks.
I'm looking forward to being able, I think it's over a year since I've been in a store or in someone else's home.
Anyone 80 years or older will get their first shot mid-March. The same goes for First Nations people who are over the age of 65. But there's a new approach to the COVID-19 fight in BC. After consulting with the Federal Immunization Group and countries like the UK and Israel that are ahead of their vaccination schedule, BC will delay the second dose by 16 weeks.
The important thing that we have learned is that these vaccines work, they give a very high level of protection, and that protection lasts for many months.
That will push the timeline up for other age groups.
We will reach more of our population much more quickly with the extension of second doses and the other vaccines that are now getting approved and are going to become available.
The approval of a third vaccine, Oxford-AstraZeneca, which doesn't require special freezers, will allow the province to look at getting some people vaccinated earlier than expected. This would include police, firefighters, teachers, and those who work in processing plants, although a timeline isn't available yet.
We are working on how to, which of those are most at risk from infections and outbreaks, and we've seen a number of outbreaks in some of those settings.
The delay of the second shot doesn't bother Shirley MacDonald, and she certainly won't let her guard down until she gets the second dose.
When the rest of the family are done, it'll be even bigger relief.
It'll allow her more visitors and more freedom, especially since this is as far as she's able to get out of her house, the driveway of her home. Robin Gill, Global News, Surrey, BC.
Canada's vaccine rollout plans include adults. No vaccines have been approved for use in children. Doctors say COVID-19 can have a significant impact on some children, though nowhere near the effect on older people. Those under the age of 19 represent about 16% of the cases overall in Canada. There have been 4 deaths recorded in people under the age of 19 here in Canada. Some vaccine trials are now underway in children, but it will take time. As Heather Yourex-West reports, that means any hope of reaching herd immunity will have to wait.
For the last year, the Lucier family has been on an almost total lockdown. 9-year-old Braden is immunocompromised and cannot risk contracting COVID-19.
12 months since he's been to a park, since he's been able to play with other kids. It's a lot.
Lucier doesn't see that changing until every member of the family is vaccinated. But right now, there are no COVID-19 vaccines approved for use in children. The Pfizer-BioNTech shot can be used for teenagers as young as 16, with some exceptions allowed for medically vulnerable kids as young as 12. For everyone else, safety trials have only just begun.
Pfizer and the Moderna, those companies are doing bridging studies in adolescents right now, 12 years of age and above. And the expectation is that there will be results by late spring.
Only after those trials are completed will the vaccine be studied on children under the age of 11 or 12, which means it could be well into next year before a COVID-19 vaccine is available to all.
When we talk about what it takes to get to herd immunity for this virus, it's vaccinating about 3/4 of the population. And it's really hard to get there to 3/4 of the population without vaccinating children.
Children can get infected with COVID-19 and contribute to viral spread, but they are less likely to suffer from severe illness, which may lead fewer parents to opt for the shot.
There are things that we as doctors and scientists owe to parents, and first on that list, I think, is robust safety data from children. And that's why the trials that are going on now are so important.
The data will help doctors combat vaccine hesitancy among parents when vaccines are approved for children. But in the meantime, it also means medically vulnerable families like the Luciers will have to stay locked down and on alert. Heather Yourex-West, Global News, Calgary.
Manitoba released new data today showing how COVID-19 infections have disproportionately impacted various populations in that province. Between May and January, 51% of people who tested positive in Manitoba identified as Indigenous, Black, or other people of color. Only 35% of Manitobans belong to a racialized group.
We know people in BIPOC communities are more likely to live in lower income neighborhoods, live in overcrowded and or multi-generational households. They're also more likely to have low wage occupations and be employed in higher risk occupations.
The province says it will work to introduce changes to health and social systems to reduce the risk in racialized communities. In the U.S., Johnson & Johnson has now begun shipping nearly 4 million doses of its newly authorized vaccine. Canada is expected to follow suit on approval in the coming days. That is significant because this shot only requires one dose. It is easier to transport to remote areas. And as Jackson Proskow reports, it appears to stand up to some of the more contagious variants that are causing so much concern.
Rolling off the line, one shot that could change everything. The Johnson & Johnson vaccine needs just a single dose, not two. And unlike its rivals, it does not need ultra-cold storage. Epidemiologists see it as a breakthrough.
That is going to be really key to reaching those populations that are traditionally harder to reach because they just don't have the best access to health care and they're in locations that don't have infrastructure.
In clinical trials, Johnson & Johnson says its vaccine prevented all deaths and hospitalizations and held up against the virus variants that have raised so much concern.
So whether it was the South African variant that we know is particularly challenging or the P2 variant in Brazil, our vaccine showed 85% effectiveness in severe disease, and it kept all the patients out of the hospital and from dying.
In Canada, the vaccine is still pending approval. Up to 38 million doses are on order, and Health Canada expects to make a decision soon.
There was a last piece of some of the manufacturing data that we were expecting, and we received that on Saturday. So we're expecting to make a final decision within the next couple of weeks.
Timing is important in both countries, as the sharp decline in cases seems to have stalled. In the U.S., the CDC director warns of a looming fourth surge.
At this level of cases with variants spreading, we stand to completely lose the hard-earned ground we have gained.
Having yet another vaccine is perhaps the best defense, but it also raises the risk that a skeptical public will go vaccine shopping, looking for one specific shot. Public health officials caution against that and say that any vaccine that has been approved is successful at its primary goal of keeping people alive and out of hospital. Donna?
Okay, Jackson Proskow in Washington, thanks. Toronto-based Porter Airlines has delayed its return to the skies by another 6 weeks. The airline now says it plans to resume flights on May 19th instead of March 29th. Porter says restrictive travel rules made an early spring restart unrealistic. It's also warning the date may be pushed back again if pandemic travel restrictions are not eased. Demanding answers and accountability. Coming up, the firefighters who say they were traumatized by Nova Scotia RCMP. Plus, Harry and Meghan on the record about splitting from royal life. Those who choose to work as firefighters know it is risky and potentially dangerous, and they're trained to handle that. But two firefighters in Nova Scotia could never have prepared for what happened to them. Without any warning, plainclothes RCMP officers fired shots into their fire hall. It was the middle of that manhunt for the suspect who'd gone on a rampage nearby. And 10 months later, those firefighters still don't have an explanation of why they ended up in the firing line. Sarah Ritchie reports.
I remember thinking when I was in there, how am I going to die?
In the middle of a manhunt for a mass shooter, two RCMP officers opened fire outside a fire hall in Lower Onslow, Nova Scotia. More than 10 months later, no one has told the men who survived what happened.
I mean, they put us through hell, I'm going to say the word, that day, and I think we need an explanation. And it should have been done months ago.
Onslow Belmont Fire Brigade Chief Greg Muse and Deputy Chief Daryl Curry were inside when the shots rang out at 10:21 a.m. Across the street, a neighbor saw an unmarked car stop on the highway.
The two doors swung open. Two people ran towards the fire hall. One went in the ditch, one went behind the garbage bin, and they just opened fire.
The Mounties shot toward the main entrance of the fire hall, damaging the building and a fire truck inside. The shots flew past another RCMP officer standing next to a marked cruiser and an emergency management office coordinator who was wearing a reflective vest. It's believed the Mounties mistook one of them for the gunman. Gabriel Wortman was driving a mock cruiser and wearing a police uniform and vest at the time. He killed 22 people over 13 hours on April 18th and 19th, 2020. Surveillance video viewed by Global News shows the two Mounties spent less than 2 minutes on the property after the shooting. And for an hour, the men inside the hall say no one told them that the shooters were the police.
We were terrorized for 1 hour by the RCMP in the middle of the worst mass shooting in Canadian history.
Curry and Muse say the RCMP has never apologized. The RCMP won't comment on the shooting at the fire hall, citing an ongoing investigation by Nova Scotia's independent police watchdog, the Serious Incident Response Team. Donna.
Okay, Sarah Ritchie in Halifax, thanks. Ahead, Myanmar's pro-democracy protest endures in the face of the bloodiest day yet. Defiance in the face of a fierce police crackdown in Myanmar that killed 18 people on Sunday. Hundreds of demonstrators clashed with security forces in the country's largest city again today, demanding the elected government be restored. And ousted leader Aung San Suu Kyi made her first appearance since the coup, appearing in court via video link. 2 new charges against her were announced. It's not clear what punishment they could lead to if she's convicted. Her legal team says they were not able to meet with her. Suu Kyi was initially charged with illegally importing 6 walkie-talkies and for holding a campaign rally during COVID-19. Former French President Nicolas Sarkozy has been found guilty and sentenced to prison for corruption and influence peddling. It's only the second time in modern French history a president has been convicted of a crime. The 66-year-old led France from 2007 to 2012. Sarkozy was found guilty of trying to get a judge to give him confidential information on another case against him, promising to give the man a prestigious job in return. Sarkozy was sentenced to 1 year in jail and plans to appeal. Prince Philip switches hospitals. Up next, an update on his health and that tell-all interview with Harry and Meghan.
Almost unsurvivable sounds like there was a breaking point.
That is a teaser from Oprah Winfrey's conversation with Harry and Meghan, their first in-depth interview since the couple moved to California and withdrew from royal duties. Harry has often said he didn't enjoy being a prince, and he's blamed the British tabloid press for destroying his mental health. He also blames the press for hounding his mother, Princess Diana. And in this interview, he says he feared history would repeat itself.
I'm just really relieved and happy to be sitting here talking to you with my wife by my side, because I can't begin to imagine what it must have been like for her going through this process by herself all those years ago, because it has been unbelievably tough for the two of us, but at least we had each other.
The primetime special airs Sunday night. You can watch it right here on Global. Well, Harry's grandfather is Prince Philip. He is 99 years old, and he's been in the hospital in London for 2 weeks now. Today, he was moved to a different hospital that specializes in cardiac care. There have been calls to postpone airing that tell-all interview. That to do so while his grandfather's health is so precarious is thoughtless and selfish of Prince Harry. Crystal Gamansing explains what we know about Prince Philip's condition.
Open umbrellas on a sunny day in London, a signal something was afoot at King Edward VII Hospital. It's unclear if this ambulance had Prince Philip on board, but Buckingham Palace confirmed he was transferred.
Let's hope he gets to his birthday, bless his heart. Yeah.
We'll get a telegram, then.
I think it's a telegram from the wife, yeah.
The Duke's heart might be the reason he was brought here to St. Bartholomew's Hospital. Its heart center is the largest in Europe, specializing in cardiovascular service. Palace officials say while here, he will undergo tests for a pre-existing heart condition. In 2011, he had a stent put in to fix a blocked artery.
I don't think Prince Philip's the sort of person who would like to have passed away in hospital.
Phil Dampier is a royal expert.
The fact that he didn't go in an ambulance to Windsor Castle, but he went to another hospital, gives me some hope that obviously they're still hoping that he can be treated and that he can leave hospital.
This is the longest stretch of time Prince Philip has spent in hospital. Last week, his grandson, Prince William, said he was okay. That followed a visit by Prince Charles, which whipped up speculation on the Duke's condition, especially given COVID-19 restrictions.
He's always been extremely close to Princess Anne, his only daughter, and if she went to visit him in hospital, I would be slightly concerned that she was perhaps going to say goodbye.
At this point, Prince Philip is said to be comfortable and responding to treatment for an infection. He's expected to remain in hospital until at least the end of the week. Crystal Gamansing, Global News, London.
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is the sunset over Horse Lake, a popular ice fishing lake near 100 Mile House, BC. We'd love to see your part of Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.